Well, hey everybody, it's Patricia Locke Dawson, and I'm here with my friend Becky Barnard, who is a nurse practitioner at the Loma Family Health Clinic. And she is here with me today as part of my First Responder Friday series. So I wanted to talk to Becky and see what is going on in the family clinic setting, but also just how she's been dealing with this pandemic as a first responder. So first of all, I guess I would say, how are you, Becky, and how are you holding up?
I'm doing good. Our family is holding in there just like everybody else. It's just an unprecedented time, and we're just hanging in there like everybody else.
So who all is your family? Why don't you tell everybody who you've got there?
So I'm sure a lot of you are relatable to me. I actually have 3 teenage daughters. So they are doing distance learning just like the rest of your kids. And it has been quite a learning curve for us over here. Patricia and I were talking just before this, learning the limits of our Wi-Fi as a family, and the challenges that come up with teenagers not being able to see their friends and things like that. And, you know, just trying to stay positive and try to just take it day by day and not look too far ahead.
Becky, tell me a little bit about sort of where you work and what your clinic is like and what are the kinds of things you're seeing and doing there.
Okay. I know when Patricia asked me to do this, I was very honored. I work in a family medicine clinic for Loma. So a clinic obviously is going to look a lot different than the hospital. So in family medicine, we see a wide variety of patients, 0, 3 days old, all the way to 99. So we see a variety. We acute patients for sick visits, and then we have a lot of our chronic condition patients. So the difference between us and the hospital, of course, you're going to the emergency room is because you have an emergency, but everything else, it filters through your primary care provider. So that's us. So when this pandemic hit, we had things set into place, such as the telemedicine, which has become very popular in the last 6 to 7 weeks. So we transitioned our patient visits to doing either Zoom calls, or we have a thing at Loma called MyChart. So doing video visits with patients, and we have been really surprised at the outcomes. There isn't anything better than hands-on, but when you can't get hands-on to patients, it's good to see them through the screen. We still are seeing some emergent cases in the clinic, but for the most part, we're doing televisits.
You're getting, I would imagine everybody's freaking out, because to me, it seems like the range of symptoms, because we've
are very wide.
Something like this before. You could have a headache, you could have, a fever, you could have a little bit of a cough, a sore throat. Who knows? How do you, as a, as a healthcare provider, how do you, number one, figure out what's going on with somebody, and two, how do you make them feel better if they are having those things? Because I know I would be like, I've got a sore throat, I know I've got it.
Yeah. So originally, everyone first, heard of the fever, cough, and shortness of breath. And then, as you know, the CDC added on the 6 new symptoms, and it can be sudden loss of taste or smell. There are some GI symptoms, sore throat, headache. I don't know if I hit all 6. So it is hard, and it's hard not to be anxious when you experience just one of those things, because you don't know what's coming for you. So, at appointments. So one thing I did want to portray on here is, always, instead of, we don't want everyone running to the emergency room for everything, although we do want people still going there because we want to keep our hospitals in business. But, if you are established with your primary care provider and you're experiencing any of these symptoms, just to reach out, make an appointment, And, you know, depending on what county you live in, there's different testing centers, but also some reassurance that, you know, COVID is bad and it has taken a lot of lives of precious people, but the reassurance is most people that do get COVID do have mild cases. So if you do happen to come down with it, you know, most people have a mild case and they're able to recover. We want people, of course, physically distancing, but one thing that has become concerning for me is we don't want people isolating. So of course, if you have COVID, you're going to have to isolate in your home, in your room, but physically distance with people, but don't isolate yourself, meaning you can always reach out to a friend. You know, we're all feeling anxious and worried and we're all, you know, in our homes by ourselves, it can get scary. But, you know, reaching out to a friend through text message, getting out for a walk, getting that vitamin D is good. You know, vitamin D is an antimicrobial, getting fresh air, exercise.
So Becky, though, people have to stay home, but that can't be good either, right? Because if they're too isolated, they're missing their connections with people, right? So I think that's probably not good for their mental health, particularly if they live alone.
Yeah. And so a lot of patients that we're seeing right now, you know, we're having, you know, increased depression symptoms, anxiety symptoms. They're feeling isolated, especially, you know, seniors that live alone. Everyone is feeling very isolated. And of course, we want people to physically distance, but we want to challenge everybody to, you know, reach out if you know you have a neighbor or a family member that lives alone, either, you know, dropping by something on their porch to brighten their day, or reaching out through text message. And then being in your home, whether you live alone or with your family, you know, we can start feeling really anxious when we're, you know, watching the news or hearing numbers. So we really want people just to take advantage of getting outside, going on that walk, getting, you know, vitamin D. Vitamin D is an antimicrobial. So we want you to get sunshine, fresh air. And then right now, you know, all those comfort foods are sound amazing. And of course, we want you to be able to indulge in those, but really focusing on your nutrition, you know, your water intake. If you're taking a daily multiple vitamin, making sure you're getting enough rest.
Just curious, as a healthcare provider, have you ever expected to deal with something like this? I mean, I'm guessing, are you guys trained to deal with this? And I mean, this is like nothing any of us have ever experienced.
Yeah, I don't think anyone would have ever thought that we would be at a place where we are now. Anybody that I know that I've talked to has never experienced anything close. But, you know, we do have protocols set into place for things such as this. I know at my institution, we had emergency protocols that we were able to shift gears and go right into. I don't think that anyone had ideas on materials like the gowns and the masks, and I don't think anyone could have ever even forecasted we would need so many, because, you know, it is respiratory illness. So, you know, the face coverings are so important. But for the areas that we haven't been prepared for, I feel like, you know, we've caught up pretty quickly, and we've learned so much. You know, I mean, hopefully we would never have to go through anything like this again. But yeah, and in times like these where things are so uncertain.
How do you, all we're being asked to do is stay at home and wash our hands and cover our faces. Every day you go into a healthcare setting where you might, you know, it's a really life or death situation. I don't care what kind of healthcare setting you're in. So, I mean, this is interesting. People want to know what it's like there and how you're keeping your family safe. I mean, does it worry you when you come home? I mean, do you have a procedure when you get home on how not to bring it in the house?
Yeah. So at our house, what we do, and one thing I didn't touch on earlier, which has been a challenge with the 3 teenage girls, is my husband and I are both essential workers. So keeping the kids on task when we're away from the home can definitely be a challenge. But what my husband and I both do, because he's still working as well, is we our shoes live in the garage, and then we come straight to our room and change our clothes. Right now I'm wearing scrubs to work, so changing clothes and either showering or putting something right on. And then one thing that I've done that has been really hard for me, all the hugs and kisses that I want to give my kids, I'm gonna wait till this all passes. And so like no snuggles right now, just until this is over, just in case, because you never know.
That must be so hard. I know how that is.
It is.
Yeah.
It is.
Have you seen anything inspirational or anything that's given you any kind of hope?
That we're celebrating everyday heroes, not even just healthcare workers, but like police officers, firefighters, grocery workers, truck drivers. And I really love that everyone is celebrating those everyday heroes. Focus has turned on, being thankful, being grateful for all the grocery store workers, all the truck drivers, and then of course like medical, the police officers, first responders, firefighters. I really, really like that. I think that's one thing that it has been really, inspiring, and it brings hope for the future.
I think so too. I just am enjoying this reset or pause specifically for that reason, just that we're reminded of what's important in life, right?
Yes, for
But
sure.
it isn't all about what we generally chase every day. It's really about our families and folks that help us and helping each other. I think that's important. So anyway, well, thank you, Becky. I appreciate it.
Oh, thank you for having me.
Yeah, and is there any place that we should tell folks on where to go to get more information about any of this that you can think of?
I really enjoyed our county website. I really like, they put the daily numbers. I really like that Riverside also reports recovered patients, because a lot of counties, if you look at all the counties in California, even if just doing a simple Google search of California COVID cases, it lists all the counties, and I believe yesterday was the last time I looked, but Riverside reports recovered cases, and I think that that's really important. So, doing a Google search, I know if you're on Facebook, there's a tab, a COVID information tab, but even just here in Riverside, I really like our county page, because I think that it's honest, and they keep it, they update it I don't know if it's every morning or every afternoon, but it's updated every day. So it's a really easy way for people to get information that's accurate.
Yeah, and my understanding is Riverside County is one of the top 3 counties for testing in the country right now. So I think we're leading the way, as we are apt to do here. So
Riverside County has definitely, like you said, they're paving the way for other counties. They've done a great job.
Okay, well, you stay safe, and I really appreciate your time. Thank you very much. And
thank you for having me.